Well, a recent study showed that breast cancer rates in women under the age of 50 are increasing. And according to the National Cancer Institute, about 40% of women have dense breast tissue, which makes it more difficult to find breast cancer early. So joining us now is Mary Mitchell, St. Luke's breast radiologist. Thank you for being here.
Yes, thanks for having me.
Absolutely. We're talking about a very important topic today. And the Food and Drug Administration actually implemented a new requirement for mammography facilities to notify patients of their breast density. Why is that so important for patients to know?
So it's actually something that we at St. Luke's have been doing for several years. We tell all patients who get a mammogram if they have dense breast tissue or not. We feel it's very important for women to know if they have dense tissue or not.
Okay, so what is dense breast tissue, and does it put women at a higher risk for breast cancer?
In short, yes. So dense breast tissue, so the breast is made out of fibroglandular or breast tissue and then also fatty tissue. And so women who have dense tissue have more of that breast tissue versus women with fatty tissue have less of that breast tissue. And on mammograms, breast tissue is white. Unfortunately, a lot of times cancers also show up as white on a mammogram. So it can make it harder for us to be able to see, to find those breast cancers on, on a background of white, dense breast tissue versus someone who has fatty tissue. Kind of a double whammy. Dense tissue can make it at an increased risk to develop breast cancer for those patients. So it can be harder to see and find and can also increase your risk.
I gotcha. Okay, so patients with dense tissue may need additional screenings to help identify or rule out breast cancer. Can you explain the fast breast MRI and how this additional screening is beneficial?
Yes. So in addition to annual screening mammography, those with dense breast tissue, we also recommend that they potentially get this additional screening tool, what's called a fast breast MRI. There are different tools that you can use to screen for breast cancer aside from mammography, but we at St. Luke's decided to use breast MRI. It finds the most cancers and it also decreases false alarms.
Okay.
So kind of in comparison to ultrasound, fast breast MRI is what we offer and recommend to patients who have dense breast tissue.
I gotcha. Okay. Now, a recent study actually showed that breast cancer rates in women under the age of 50 are increasing. So what would you say those who are younger than the screening age of 40 do to be proactive?
Yes, we do recommend that all women by age 25 really have a conversation with their doctors, their gynecologists, their primary care doctor, to really determine if they are at increased risk for breast cancer. Because if they are, then they may need to start screenings before the age of 40. So we really encourage that women, by age 25, kind of determine that, talk with their doctors about that.
Start those conversations.
Yes, because they may need to start before 40.
Gotcha. Okay. And I know we kind of touched on it, but why is early detection of breast cancer just so important?
Yes, 1 in 8 women are going to develop breast cancer over their life, and half of fatal breast cancers will be diagnosed before age 50.
Oh, wow.
So that's also an alarming statistic. And so it's definitely, we definitely want to hone in on especially our younger women to make sure that they determine if they're high risk or not. At St. Luke's Breast Centers, we offer the highest level of technology. We offer 3D mammography at all of our sites. Also the fast breast MRI for those who have dense breast tissue. And then if they are at increased risk, we also have a high-risk breast clinic that we offer.
That's awesome that you guys have those services to offer to the community. And again, I think it's just important to have the conversation, get as much of that information as you can early on. So thank you so much for joining us today to talk about it.
Yeah, thank you.
Absolutely. Well, guys, to schedule a 3D mammogram at one of St. Luke's breast centers, you can go to stlukeskc.org/